सगळ्यांक देव बरो दीस आनी very happy and healthy and hearty day to all of you. We have with us Dr. M.D. Dixit, one of the most globally known uh, cardiologist and cardiosurgeon from Arihant Hospital, Belgaum. Dr. Dixit doesn't need any introduction, as so far in the last about period of about 30-35 years, sir has performed about 35,000 plus surgeries with a phenomenal success rate of about 95% plus, about 95%. आपल्या काळजा भाशेन तुमची काळजी आपल्या काळजा भाशेन तुमच्या काळजाची काळजी घेवपी दोतोर म्हळ्यार डॉक्टर दीक्षित. So, sir, we'd like to speak about the rising issues among the youngsters, of heart issues among the youngsters on this World Heart Day. So, over to Dr. M.D. Dixit.
Thank you, Louis. And greetings from Arihant Hospital to all the Goans. As you all know, Goa is my second home, and people of Goa have always been good to us. Now, the important topic which Louis has raised about increasing or the rising trend of ischemic heart disease in young population. We hear a lot of stories about young patients aged between 28 and 40 years who have sudden cardiac arrest, or who have acute myocardial infarction, what we call heart attack, requiring stents or bypass surgeries. And this has been alarming, and even we are little alarmed by seeing more often these things. I used to say earlier, we used to see son bringing his father for surgery. Now we see grandfather bringing his grandson for surgeries. So that is the changing trend that is happening. And why this is happening? And this has been because of our lifestyles. Though a lot of people have thought that it could be related to COVID or something like that, the incidence of heart disease definitely has gone up. But more important than anything else has been the sedentary lifestyle that we have, the bad diet that young people are up to now, because most of them go out and they stay alone. They are studying in the colleges and other thing, or they go for a job and they're staying alone. Unfortunately, they depend on the packaged food or outside food for their sustenance. And these bad diet, or whatever, processed food, packaged diet, all these things, with lack of exercise, the physical activity has come down to such an extent due to the technology that we hardly move. So coupled with this, the amount of stress that these kids undergo now, and also they keep working hard, hours together, not taking their sleep seriously, keeping awake at night, and working hard. So all these things, bad diet, lack of physical exercise, insomnia, that is sleeplessness, and stressful life, all these things have led to what we call that heart disease. Not only this, we see a lot of incidents of obesity, hypertension, diabetes happening in these young people. So my only advice to these youngsters who are there, who are about 20-25 years, who are there, I would say that you have to keep yourself physically active. Spend 1 hour every day for your physical activity. Second, if you can cook your own food, that is the best thing. Fresh vegetables, fresh fruits, eggs, milk, curds, and whatever we prepare fresh at home, if you are able to eat this regularly and reduce the number of uh, intake of food. For example, if you just restrict yourself to breakfast, lunch, and dinner, you will not be able to put on weight. What we eat in between these things is the one which uh, puts on the weight. That's why avoid all these snacks and other thing, and avoid sugar, avoid bakery product. If you are able to do these things and enjoy your life, definitely your heart disease incidence will come down. So my only request is, I always tell, fast food brings fast death. So avoid all those things and just make sure that you take care of your heart. Majority of the time, only when we get a heart attack, then we realize that we have got a heart. Otherwise, we don't realize till then. So my advice to all of you is, remember that you have got one heart, take care of it, and good luck to you.
Sir, about the success rate that we are talking of, see, out of the 35,000 odd cases that you have operated, the success is 95%. It's quite phenomenal. And lots of, not only from India, but patients from abroad are visiting Belgavi, especially for a treatment from Dr. M.D. Dixit. Sir, anything particular you would like to say that, people are so, confident about you, and they have established the faith in you, sir? Like, what is the secret, or what is the, how would you rate this success of phenomenal success of percentage of the success rate, sir?
No, the most of the procedures in heart cardiac have now been standardized, and it is just as long as you follow your basics correct, and you maintain your standard procedure or standard operating procedures, I think everything should be fine. Nothing great we are doing, but it's only that we do not compromise with the basics, and we make sure that only people who need surgery are operated, and stick on to take every patient that comes as your first patient, give importance to each and every patient, and that's how we have been able to maintain it. But I think majority of the people are doing good work nowadays.
सो थँक्यू सर. तो हांवें वडोळ म्हळ्या भशेन आपल्या काळजा भशेन तुमच्याय काळजाची काळजी घेवपी काळीज तज्ञ म्हळ्यार आमचे डॉक्टर M.D. दीक्षित जावन आसात. तुमी आयज काल तरणाट्यामध्ये एक्सरसायज केल्यार आमचे सगळे BP आनी शुगर आनी हे सगळे कंट्रोल जाता असो एक भ्रम आसा. पूण दोतोरांच्या सांगण्या प्रमाण मोर दॅन एक्सरसायज, इट इज द डायटरी हॅबिट्स अँड इट इज अ सफिशंट स्लीप अँड देन एक्सरसाइज. सो दीज आर द थ्री थिंग्स. ही त्रिसूत्री आसा जेणे करून आयज आमच्या तरणाट्यामध्ये जे रोग वाडटात, जे आयज हार्ट अटॅक्सचे प्रमाण वाडलां, ते उणे जातले. सो विशींग यू ऑल वन्स अगेन अ हॅपी वर्ल्ड हार्ट डे. आणि आय ऑल्सो एक्सटेंड गुड विशेस टू द पेशंट्स ऑफ डॉक्टर्स इन गोवा who have been relying upon him for their heart. So with cameraman Mahadev Pawar, this is Louis Rodriguez from Belgaum. Thank you.